Hi, David McIntosh from ENT Specialist. Just want to talk to you about middle ear infections today. Middle ear infections are very common in children. In fact, it's said often that every child under the age of 2 will have at least one of these infections. Now that may not be absolutely true, but that gives you an idea of exactly how common they are. Some children get them a lot. When it comes to managing ear infections, it's important to have your GP involved to determine whether antibiotics are needed or not. There are some really important guidelines out there regarding antibiotics, and I'll have a different video to talk about that in due course. But if you end up seeing the doctor and you end up needing antibiotics to help the ear infection in your child, then you need to be aware that often it's just a one-off, maybe 2, maybe 3. Rough rule of thumb though is when is too much, too many infections too much. And the answer to that is there's nothing carved in stone, but we have some rough guidelines. So roughly speaking, around about 4 and 6 months or 6 in a year is getting up there. And if those infections need antibiotic courses, then that's probably the time to be seeing a specialist to have an assessment. The child may need no further intervention, it just needs to be watched, but sometimes children need surgery. And that surgery is the insertion of a little plastic tube called a grommet. We'll talk about grommets some other day. So, if your child is having a problem with ear infections, step 1, make sure you see the GP. If they're ending up needing antibiotics for it, keep a record of how many courses of antibiotics they're having over the time period where they're suffering these infections. And if it seems to be getting up there a bit, talk to the GP about organising to see a specialist just for further advice. Have a good day.